Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 565,506 confirmed cases of COVID-19 in Canada and 175,908 cases in Ontario. Chatham-Kent has 667 cases and Sarnia-Lambton has reported 692 cases. Michigan now has 483,922 cases, with 25,486 cases being in Detroit. Today we are reporting 163 new cases of COVID-19 in Windsor and Essex County. 34 cases are related to outbreaks, 2 are close contacts of confirmed cases, and 125 are still being investigated by our staff. We have had 7,374 cases since March. 5,431 cases are now resolved, and 1,814 cases are active and being followed by our health unit. 516 people have been contacted using the virtual assistant tool. And if you receive a text, please complete as much information as possible. 90 confirmed cases of COVID-19 are currently in the hospital and 19 people are in ICU. There are 130 suspected cases of COVID-19 currently hospitalized. Our community has lost 129 people to COVID. 79 deaths have occurred among residents in long-term care and retirement homes. There are currently 42 active outbreaks in Windsor and Essex County, 16 long-term care and retirement homes, 17 workplaces, 3 schools, 4 community outbreaks, and 3 hospital outbreaks. Please continue to follow our public health measures. Stay home if you're sick, limit your close contacts to your household, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, and cover your mouth and nose with a tissue, or use the inside of your elbow when you cough or sneeze. If you haven't already done so, please download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As we continue to see an unprecedented number of COVID-19 cases in our region, there is also some good news to share. Because of our high case rate, Windsor-Essex County is one of the priority area for rolling out COVID-19 vaccination. On December 21st, the region received the delivery of Pfizer-BioNTech vaccine, and Windsor Regional Hospital started vaccinating the healthcare worker working in the long-term care home and retirement homes. With the approval of Moderna vaccine, Windsor-Essex County Health Unit is expected to receive Moderna that will be rolled out to long-term care home and retirement home that are not in outbreak. We are using a risk-based prioritization matrix to identify homes that will be booked to vaccinate using Moderna. With the rollout of Moderna vaccine, that we can take it directly to the home, it will help us to protect our most vulnerable in the population. COVID-19 has impacted our long-term care home and retirement homes the most. By vaccinating the long-term care home workers with Pfizer-BioNTech vaccine and the residents of these homes with Moderna, we will add another layer of protection for our most vulnerable population. Our team has already started the outreach to some of the homes based on the risk-based prioritization matrix to get them prepared to vaccinate the residents. While it is exciting news for many, but it does require careful planning to mobilize the vaccine, maintaining cold chain, train staff to administer the vaccine, share the relevant information with the residents and their family, and get their informed consent, complete all the appropriate documentation using the ministry COVAX system. It all requires careful planning and delivery. We heard that Moderna vaccine will arrive sometime later today, and we anticipate that we'll start vaccinating our residents of long-term care home and retirement homes starting Monday. Thank you.
We'll now take questions from the media. We'll start with CBC.
Hi, yes, good morning. Could you share with us a little bit more about the vaccine, the Moderna vaccine? How many are we receiving this time around?
So we'll have to wait and see how many we are receiving, and we may receive some enough to vaccinate at least half of the population that are currently residents of Windsor, all the long-term care home and retirement home, and there may be some future supplies that will come to us, but I cannot confirm at this time the exact number of those.
And is it still going to be a percentage of the individuals at each home? Like I think it was 30% last time. Like, can you tell me what that'll look like in terms of how many people at each home are going to be vaccinated?
So with the homes, the reason that we kept a certain proportion of workers vaccinated using Pfizer-BioNTech vaccine was because of their ability to work. We want people, if in the worst case scenario, if they develop any kind of adverse events, so which is some with many vaccines, it's common, like injection site pain, fever, any kind of rash that may prevent them from working even for 1 or 2 days. That means a lot for a home that are struggling with many of the staffing challenges. That may not be the case with the residents, and the residents would like to see that we maximize the number of residents in the facility and then get them vaccinated. So when we are starting a facility, the plan is to go through all the residents and vaccinate each one of them before moving on to the next facility.
And so just to confirm, so residents first and then staff in this round?
So the staff will continue to go to the current model, which we have established at the St. Clair College using the Pfizer-BioNTech vaccine, because the staff can go there. With the limited supply, Moderna, we are able to move. And so the plan is we take it to the most vulnerable. So even if, let's say, few vaccine, if we can put it in the arm of the residents, that's much better. While because the workers still have the ability to mobilize and move and go to the vaccination site at the St. Clair College. So the model will continue to be the same. The workers will continue to go to where they are getting their vaccine. When we are going into the home, we are only vaccinating the residents.
Okay, thank you so much.
Any questions from Blackburn?
No, not this round. Actually, you know what? I wanted to talk to you about the virtual assistant. You mentioned that 516 people were contacted yesterday. Do you know yet how many people have actually signed up for this?
So 519 people have used the virtual assistant. So it's not that they sign up. If they're a case, in our interview with them, in our call with them, we ask if they have a cell phone and if they'd be willing to use this virtual assistant to actually capture their contacts. So once we've talked to them, we have their cell phone number, we push it out to them. And so it's basically a survey that they complete. So 516 people have actually received this, the text from us, and we have had probably 270 people complete it, the all components of the survey, and the rest are partially completed, the survey questions. And then through that, we have revealed, or through the tool, another 95 contacts have been identified that we then follow up on and ask them to isolate. So it's not a sign up, it's once you're a case, we will offer this to you as another means to get your contact information. Otherwise, we're on the phone, doing a lengthier interview with the case.
Are you satisfied with that uptake so far?
It seems quite good. It is another way to relieve some of the resource pressures we have, and it puts a little bit more responsibility on the person to be accurate with what they're completing. But they also are the people that have that information, and they can complete it and think back and say, oh, okay, I was with this person, and then put in the accurate information. So we're happy with that, and we hope more people with the cell phones will take advantage of this extra tool.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Doctor, can you speak more about the vaccine? You mentioned a risk-based model to decide which homes will be receiving it. Talk about that risk-based model. How do you decide that one long-term care retirement home is at a higher risk than another?
So within the long-term care homes, there are classification, A, B, and C classification. And so essentially, if you have a C classification, that means the facility is old and with many beds that are either in a I guess shared accommodation type setting versus a single unit setting. So there are those classifications that exist. So that's the first one, and then the second one, the size of the facility. The other one is any long-term care home and retirement home with memory units attached to it, and their history of previous outbreaks and how the outbreak was contained in that facility. In some homes, we have more challenges in containing the outbreak versus some of the other homes. So we combine all of those variables together to come up with a composite score to identify the home that would be score high, and a home scoring high means that there is the highest risk, home with the highest risk, and then they go on top of the list. If they're not in outbreak, so that's one of the criteria that the facility that we will target in the first cycle would be the facilities that are not in outbreak. And then once we go through that cycle, the next facility what we target is the facilities with contained outbreak. And when I'm saying contained outbreak, that means very few people are affected by it, and there's no ongoing transmission, and there is no ongoing risk of exposure in that facility. And then followed by that, we'll hope to see that we complete the cycle and vaccinate all the homes in the region.
You said the health unit would be receiving these. Is Moderna being shipped to the hospital, to Windsor Regional Hospital, where they have the freezers to contain it? And who will be administering the vaccines to the residents?
So I'll pass it on to Teresa to answer this question.
So our health unit actually we have a freezer. So the Moderna vaccine is not needing a deep freeze as the Pfizer vaccine required. So the province has supplied our health unit with a freezer, so we will be storing the Moderna vaccine using our freezer. And then the delivery of the vaccine to the residents will be through our nursing staff. And so we are working with the homes right now to arrange the schedules and look at the workflow, but we will be sending a team of our staff to go to the homes for the Moderna also requires 2 doses, 28 days apart. So our intention is to support the homes with the first dose, and they may be in a position to administer the second dose. So we'll see how this next week goes, but we do have 8 homes that we're working with right now for next week.
Okay, and of course we've been having the conversation about how tight the resources are at the health unit for quite some time. These nurses, where are you taking them off of other duties to do the vaccination? What have they been doing up until this point?
So that's a good question, and our nurses are very adaptable and flexible, and they have been throughout this whole pandemic. So some of these nurses are the same nurses that actually have done testing, have done our case and contact management, have done vaccines with the school-aged children, and now will be helping with the vaccination of our residents of long-term care homes. So we do have a small pool of nurses that have a great deal of experience with vaccinations, and right now they are working in our case and contact management, or previously we did have a small pool doing the grade 7 vaccinations. So that was going on at the same time, and so we will be redeploying and moving around the nurses to make sure we have the support for the vaccination. But as you know, we also have had added support from the province, and this week we are getting some more case managers. So, you know, we're balancing what we have, our resources, and prioritizing. And, you know, we're using a small group of nurses to get this done, but we will see how this week goes. Or next week, sorry.
Do you know how many nurses you'll be using for the vaccine rollout?
So we have, today is the training for the actual COVAX system that the province has, and it's the mechanism to do the data entry. And so we are having between 8 and 10 nurses will be trained, attending the training, and we have the ability to add on another maybe 6 nurses that are actually working in the schools as well. So we are, you know, based on the size of the home and the different stages of flow, the assessment of the resident, the administration of the vaccine, the observation of them during the recovery period. We want to work with the home to access their staff and use their staff as well. So our nurses will be doing the, you know, immunization. So I think there will be enough support with the home's help and our nursing staff. And we're also providing clerical support as well that will go out, and IT support.
Okay, thank you.
Any questions from AM 800?
Teresa, is there a goal on how many vaccinations a health unit would like to do per day?
So right now we're working with doing 1 or 2 homes in a day, and it will be based on the readiness of the home as well. So as you know, the vaccination is not mandatory, it's voluntary. So with that comes a consent and a fact sheet. So in the homes, the long-term care homes have been working with their residents to make sure they understand what the vaccine is, and we developed a fact sheet. And also, if they have a substitute decision maker, that they're able to, you know, reference the fact sheet, ask the questions, and make sure that they're comfortable getting the vaccine. So our goal is to use the vaccine that's been allotted to our health unit, allocated to our health unit, and get as many people vaccinated as safely as we can. And you know, as shipments come, we'll keep adding. And as Dr. Ahmed said, Dr. Ahmed plays a very key role in this because he's looking at all the homes and those that are in outbreak and you know, the staff there that are impacted, but the residents that have been impacted. So people that are have COVID symptoms would not be, are, you know, and are in an outbreak and acutely ill, they would not be eligible for the vaccine at that time. So we want to just use what's been allocated to us and get as many people vaccinated and do it safely.
That was my next question about mandatory and volunteer. Are you anticipating some staff members and residents or their families will, I guess, reject the vaccination?
I hope not, and I don't anticipate that at all. I hope that people get the information they need to make a good decision. With this vaccine, as we've all been through this pandemic, you know, we've all been waiting and hoping for the vaccine. So it is here. With it, there's relief, there's excitement, and there's hope. And so I want people to get the answers to the questions they may have. Dr. Ahmed will be doing a little YouTube Q&A session. We're taping it later today to send to the homes so that if they can send it out to the family members of the residents so that they can talk to their loved one about the vaccine and answer any questions. So we don't anticipate there will be, you know, people that decline, but they have that right to if they, you know, choose to.
I'm not sure if you have this number handy, but do you know how many long-term care / retirement homes we have in Windsor-Essex?
We have 44, I believe. And right now,
Okay, thank you.
yeah, and right now we do have 16 are in outbreak. So that's where that fine balance is of doing the risk assessment for these homes.
And sorry, one more quick one here, almost staff question, but maybe a different angle. When it comes to security, I know when the Pfizer one was brought in, Windsor Regional had strong police presence and increased security. Does the health unit plan to do the same kind of thing?
So there are protocols and requirements with the vaccine, the arrival of the vaccine and the actual physical location and security of the vaccine. So our health unit has complied with all of the requirements for that, and we are doing exactly what has been directed, and it does involve security and involvement with our police services.
Thank you.
Any questions from CTV?
Yes, good morning. What advice do you have for people celebrating New Year's Eve this year?
Celebrate it at home, virtually, with anyone you want to spend time with, and people who live in your household. For people who live alone, they do have the same option just like they had at the Christmas time. They can get together with one of the family, but other than that, we are still in gray lockdown zone and with enhanced lockdown measures from the province, which basically prevents people from going into anyone's home at this time. So I seriously hope that people follow those measures. Our case counts are right now, it's plateauing. It's not going down. Again, it's better than continuing to see an increase in the community. But we have to recognize that right now our case rates are highest in the province. Our percent positivity is highest in the province. So practically the likelihood of anyone you're meeting who may have COVID is really, really high. And as I said it before, maybe you may not have suffer the same consequences that many others have experienced, but you could be at the risk of exposing other people who may either get really sick or could potentially die from it. So I really hope that people do get that message. It is, and I get it, it's not the right thing that people may want to, we like to socialize. Everyone likes to socialize, including myself, but this is just a different year. And as we talked about the vaccine is already here. There are more ways, more reasons for everyone in the community to celebrate. So I think until then, we should stick to what the public health messaging is and do our part in containing the transmission and keeping everyone safe.
So even if people wanted to be with someone else outside, and outside of their household, even if it's in the outdoors, that would also be discouraged. I know in the summer that's what people were doing, but is that discouraged at this point?
Well, under the lockdown measures, there are specific criteria, and I think even for the outdoor organized activity, that's very, very restricted at this time. So I would just request them to go through our website with more specific details on what they can and what they cannot do. But generally speaking, as I have said before, any opportunity, any reason for people to come together also increases the risk of COVID-19 transmission. And with a high case rate, with a high percent positivity in the region, those would all be very high risk activities.
Are you concerned that people won't follow it and it'll drive up the numbers even more?
Well, I think we'll have to be realistic. What we are seeing with the ongoing transmission and when people are reporting their number of contacts, it is concerning, and it's it's difficult to understand that why we're still having people with so many close contacts identified at this time. At this time, with all the recommendations, all the work, all the messaging we have done, people should only be reporting close contacts as their households. If they're reporting any other contacts, it is a concern. That means people are not following the recommendations, and so we'll like to say that this is how it should be.
Okay, thank you.
Any additional questions from CBC?
Yes, just another couple questions on the vaccine. You said that you're working with 8 homes right now. Are you able to share any names in terms of which homes are on that list to receive the vaccine first?
Okay, I'll pass it on to Teresa.
We have not talked about publicly disclosing it yet. So I think we'd want to get permission from the homes before we share it, but we haven't shared it other than with the homes, and the homes are, working with us to get the consents and reaching out to family members as needed. So, there may be some information out there, but we haven't shared it yet.
Okay, and with the vaccine, oh, sorry, go ahead.
No?
Oh, sorry, I guess I was getting an echo, pardon me. I was wondering if the media can be there today when the vaccine actually arrives at the health unit.
So the arrival of the vaccine is like at a moment's notice, and so it probably won't be likely that will happen, but I know that the communication we've received has been very, very minimal, and so to actually define when it's coming has been it's not, it wasn't engraved in stone or anything. So I think that's probably not going to be possible. I'm sorry.
Okay, no, that's all right, fair enough. And just lastly, I wanted to ask on a separate topic about the outbreak at the Salvation Army. Are you able to tell us a bit more about that outbreak? How many cases there? Is it impacting staff, clients, anything like that?
So at this time, all I can tell you is that we do work with all the facilities, all these type of settings with cases. We treat them as community outbreaks if it happens in that setting. And just like in any community outbreak setting, we do send our health inspectors to do an assessment, provide recommendations, and all of those details. I think the last that I can tell you is we did had some cases, I want to say less than 5, and there's ongoing investigation and ongoing work that's happening right now.
And do individuals experiencing homelessness still have access to motels for isolation? I know that was the case months ago, but is that still available?
That is still available, and the city is operating that hotel isolation recovery center for all this population.
Okay, thank you.
Any additional questions from Blackburn?
No, I don't. Thank you very much.
Okay, sorry, give me one sec here, I gotta find us. So any additional questions from the Windsor Star?
Yes, I'm wondering if I can just get a reaction from both of you on the fact that you are receiving the vaccine today and you are going to soon be administering it to what seems to be the most vulnerable population.
So I'll start, and I'll let Teresa share her experience as well. And I think generally we can say that we're both excited, and I keep telling this to myself and even to Teresa when we are talking, that while we're continuing to see many of these cases and sometimes feeling that there's still people who are not following those recommendations, and how do we get through all of this? And then we know that at least if we have the vaccine, we can protect our most vulnerable in the population. So that's the motivation that both of us are feeling right now is, okay, let's just put our head together, get a good solid plan in place, and protect these people. Once they are protected, it'll be a relief for us to put another shield around our most vulnerable population, and then we can continue to move on and look forward to how do we vaccinate more and more people in the community so we are all safe. So that's how I would say. I'll pass it on to Teresa.
I just think there's a different energy here at the health unit. There's not a lot of us working on site, but it brings hope. There's some relief and excitement for sure. And as Dr. Ahmed said, our goal all along with the pandemic is to try to prevent people from becoming ill and people from dying from this disease. So it's great. It's great talking to the homes and giving them this hope, and so there's excitement in the air for sure. So we're really appreciative that we've been selected and have this opportunity. I know the reasons why we are selected is because our case counts are so high, and but it is really great to be among the first to be delivering the vaccine to our residents of long-term care homes.
So I would like to add one thing, Taylor, that you should, or maybe others should also put that in your media coverage, is again, having the vaccine doesn't mean that we can stop or drop our guards down. No, absolutely not. First of all, it takes some time for a body to build the immunity. And then again, this is a vaccine and this is a very limited population that we are talking about. So all these measures, all these efforts that we are doing, we still have to do it until we get to the stage when we can comfortably say that, okay, this is the time, maybe we can let go some of these measures and we can stop doing what we are doing right now. But until then, please just be absolutely clear, all these measures still need to be followed, and we have to do our part until we get a large number of population immunized.
Okay, thank you both.
Any additional questions from AM 800?
No, I'm good. Happy New Year's, everyone.
Okay.
Oh, we got one more. Any additional questions from CTV?
Nope, I'm good. Happy New Year.
Okay, great.
Thank you.
Thanks, everyone.
Thank you.